Hello, my name is Dr. Sigal Jacobson. I'm a dentist and I'm the inventor of the Uveneer system. I created this video for those dentists who already have the kit and want to learn some tips and tricks, and also for those who don't have the kit and want to learn more about it. The Uveneer system is a very unique system. It's a template to create anterior composite restorations. It's made out of fiberglass. It's a very durable material, so you can autoclave it and reuse it many times. All you need to do is take any composite you wish, apply it directly on the tooth, press the Uveneer template, cure with a light, then remove the template, and you will get a beautifully correct, polished restoration. The kit itself has templates from premolar to premolar, maxillary and mandibular teeth in two sizes. We have the large size and the medium size. As I mentioned, each template is fully autoclavable. It has a non-stick surface to it, so it will not adhere to your composite. It has a center line on the outer side of the template to help you to position it parallel with the middle of the face. It's a very durable material, so it doesn't scratch. You can order single if you lose one, for example, and it will fit to most of your patients. The reason is that it was done according to the smile design rules and proportions. So what are the benefits of having such a system in your clinic? Well, we all know that creating composite veneer in the anterior area is a very challenging procedure. It's a time-consuming, it's very artistically challenging as well. So having a predictable system like Uveneer, it will save you a lot of time. It is only one-time investment, so the kit will last you for many years because it's autoclavable. You can use any composite you want to use. You're not restricted to one system. You will also increase your profitability just because it's a very efficient and time-saving kit. You'll start doing more cases. And the last thing, you will create actually a stronger restorations when you use a kit like Uveneer or any template system. And the reason is that when you press something hard on composite and cure it at the same time, you are breaking the internal bubbles, the voids that is in the composite. At the same time, you're also blocking the oxygen inhibition layer when you are curing. That means that your restorations will wear less and will stain less in the future. The Uveneer has many applications besides just doing direct veneers. You can create a class 4, those trauma cases that come to your clinic as an emergency. This is when the kit comes very handy. You can also use it for diastema closure by using a silicone stent and then finish with the Uveneer. I do a lot of mock-up cases. When you do the mock-up cases, no need to etch, no need to bond. Just apply composite, press, and cure, and then show the patient the result. And this is a very good communication tool. It's very nice to do a predictable dentistry as well. You can show the patient how the work is done without committing to the case. Another thing you can use the Uveneer is for provisionals for your porcelain veneers cases. Just spot etch the teeth and apply composite onto the template and press it onto the tooth. I'm going to show you now a case of two centrals that we've done with Uveneer. It took us in the clinic about 25 minutes. So here I'm applying the retractor. I like to use the retractions that have the tongue retraction as well, and then the patient can lean and bite over it so it can relax the muscles. Here I'm preparing the two front teeth only. You can remove an old composite completely, or if there is no caries detection there, you can leave an old composite as well, like I did here. And then I apply separation between the teeth. If you can see here, I'm applying a metal strips that I cut into about 3 centimeters length and pull them to the palatal side. I also like to use Teflon tapes, and you can also use cellulose strips. When you work with Uveneer, it's very important to understand that one tooth at a time is the best way to go. Don't do two teeth, etch two teeth or bond them in the same time. One tooth at a time. So here we're etching the first tooth, etching for about 20 seconds, and then dry and apply the bond. Here I use a universal bond. I do 2 layers, dry, wait for evaporations of the acetone or the alcohol, air dry, and cure the bond. This bonding step is very important. Then I apply the composite directly on the tooth. You can apply it as well in the template. I like to apply it directly on the tooth and control the quantities. How much do I need? Then I take the Uveneer and I apply a little bit of a high fill flowable into the template. And there's a lot of companies today, brands, they do high fill flowable, just a dot, and you press it. And in this way, you get a beautiful shine from the high fill flowable. You break all the bubbles. It's a very nice finish. And you get the strength from the packable composite underneath. So here you see we press the bubble all the way out. If you are missing a little bit, you can add on the missing area. Don't rush to cure. Clean the excess as much as you can. When you clean the excess, just hold the plate in your hands and don't move it. Here we're curing through the template. I don't know if you notice there is a midline there, and I position the midline parallel with the middle of the face. After curing for about 10 seconds, you will remove the template. You can also cure for 20 seconds. It depends on your light source, what the companies recommend you to cure. Do not touch the glossy surface and just trim the excess. Now we do the second tooth. I'll do it on fast forward. Again, apply the composite on the tooth, not too much composite. The enamel shade of the flowable, a high fill flowable, into the template, combine them together, and then only cure. And this is the result. This is the shine you will get, and you just trim the excess. I use an extra fine diamond burrs and then some polishing disc. I'm trying not to touch the glossy surface. Then I will clean in between the restorations. I use the interproximal saw. Final touches. Very important to adjust the occlusion. There is nothing on the way there. Nothing, no premature contact. And here we finish 2 teeth with the Uveneer. Happy patient. And that's the result after in 25 minutes. This was the before, and this is the after. I just want to mention that with the Uveneer, you can actually also apply layers. You can apply the first layer dentin, cure it, and then cut back and do second layer with enamel. You can even do 3 layers, but on each layer, I will press the Uveneer. In between the layers, you can apply a bonding material, the universal bond, or just wetting resin. You don't really need to etch unless you want to decontaminate the surface. So I will etch for 5 seconds and then apply the bonding and the second layer. Thank you. Thank you very much for joining me. And if you have any questions, you can email me on info@uveneer.com. Thank you.